Abdominal pain is one of the most confusing symptoms the body can produce. Sometimes it's something simple, like gas, mild indigestion, or a stomach bug that passes within a few hours. But other times, the same general symptom can signal a much more serious condition that requires immediate medical attention. The difficulty is that abdominal pain doesn't come with clear labels. It doesn't tell you whether it's harmless or dangerous. And many people hesitate to seek help because they don't want to overreact. But waiting too long in the wrong situation can allow a serious problem to worsen. Understanding when abdominal pain is likely manageable at home and when it may require emergency care can help you make more confident decisions during a stressful moment. Abdominal pain can appear in many forms. It may be dull or sharp, constant or intermittent. It might stay in one area or move to different parts of the abdomen, because the abdomen contains many organs: the stomach, intestines, appendix, gallbladder, pancreas, and more. Pain in this region can have many possible causes. This is why abdominal pain is often difficult to interpret without medical evaluation. However, certain patterns and warning signs can suggest that the pain should not be ignored. The first factor to consider is the intensity of the pain. Mild discomfort that improves after rest, hydration, or a bowel movement is often related to digestion. Many common stomach issues gradually improve over several hours, but severe pain that comes on suddenly or becomes progressively worse is different. Pain that is intense enough to prevent normal movement, standing upright, or speaking comfortably may indicate that something more serious is happening inside the abdomen. When pain is severe and persistent, it is safer to seek medical evaluation rather than trying to wait it out. Another important factor is the location of the pain. Certain areas of the abdomen are associated with specific organs. For example, pain that begins near the center of the abdomen and later moves to the lower right side can sometimes be associated with appendicitis. Pain in the upper right abdomen may relate to the gallbladder. Pain in the upper middle abdomen that radiates to the back can sometimes involve the pancreas. These patterns are not perfect diagnostic tools, but they can offer clues that the body is signaling something more complex than ordinary indigestion. Duration also matters. Short episodes of abdominal discomfort often resolve within a few hours. But pain that continues for many hours without improvement, or pain that repeatedly returns and worsens, should be taken more seriously. When symptoms do not improve over time, it may indicate that the underlying problem is not resolving on its own. Associated symptoms can also provide important information. For example, abdominal pain combined with high fever may signal infection or inflammation. Persistent vomiting can lead to dehydration and may also suggest a more serious issue. Severe abdominal pain accompanied by dizziness, fainting, or confusion is another warning sign that should not be ignored. There are also certain symptoms that are considered clear reasons to seek emergency care: blood in vomit or stool, black or tar-like stools, severe abdominal swelling, or an abdomen that becomes extremely tender to touch may all indicate potentially serious internal problems. These symptoms are not typical of minor digestive discomfort and should be evaluated by medical professionals as soon as possible. Another important situation involves abdominal pain following injury. If someone experiences significant abdominal pain after a fall, accident, or direct blow to the abdomen, internal injury may be possible even if external signs are limited. In these situations, medical evaluation is important to rule out internal bleeding or organ damage. Age and medical history also influence how abdominal pain should be interpreted. Older adults, young children, and people with chronic medical conditions may experience symptoms differently. In these groups, abdominal pain may represent more serious illness even when the symptoms seem mild. People with a history of abdominal surgery, ulcers, gallstones, or other digestive disorders may also need earlier evaluation when new pain appears. One common mistake people make is trying to diagnose themselves too quickly. Online searches and symptom lists can sometimes create confusion rather than clarity. Many different conditions share similar symptoms. Instead of trying to determine the exact cause, it is often more helpful to focus on a few practical questions. Is the pain severe or worsening? Has it lasted longer than expected? Are there additional symptoms like fever, vomiting, or bleeding? Is the pain preventing normal movement or daily activity? When several of these factors appear together, seeking medical care becomes the safer choice. Another important consideration is how the pain changes over time. Pain that gradually improves with rest, hydration, and light meals is often related to temporary digestive irritation, but pain that steadily intensifies, spreads to other areas, or becomes sharper may indicate an evolving medical condition. Listening to how the body's signals change over time is an important part of making safe decisions. The key insight is that abdominal pain should not be evaluated by one single symptom alone. Instead, it is better to look at the full picture: the intensity of the pain, its location, how long it lasts, and what other symptoms appear alongside it. When several warning signs appear together, they create a pattern that deserves medical attention. This structured way of thinking helps reduce the uncertainty people feel when deciding whether to go to the emergency room. It shifts the focus away from guessing the exact diagnosis and toward recognizing risk signals. Abdominal pain will always be a complex symptom because it can come from many different organs and conditions, but learning to recognize the difference between mild digestive discomfort and potential medical emergencies can make a critical difference in how quickly someone receives care. When pain is mild and improving, observation and basic home care may be reasonable, but when pain is severe, persistent, or combined with serious symptoms, seeking emergency care is the safer and more responsible decision. Responding early to warning signs can prevent complications and ensure that serious conditions are treated before they worsen. If you found this explanation helpful and want to learn more practical ways to recognize important health warning signs, consider subscribing to the channel. And if you'd like to review a structured resource that explains many common medical situations people may face at home, including how to recognize when professional care is necessary, you can find a useful guide linked in the description that walks through these scenarios step by step.